Appears to be in a dilemma over full reopening and running of the education sector. Unless the rest of the learners resume by latest November 2nd, we may be staring at the possible syllabus crisis, with learners facing the harsh possibility of repeating classes. But what possible reopening options does the government have? Shadrach Miti examines.
After learners in Grade 4, Class 8 and Form 4 resumed learning on October 12th, their colleagues in PP1 and 2, Grades 1 to 3, Classes 5, 6 and 7, and finally, Forms 1 to 3, were expected to start reporting on October 26th. Thanks to a spike in COVID-19 infections, the plan fell through. Nevertheless, Education Cabinet Secretary Professor George Magoha has maintained learning for the three critical categories of learners currently in school will continue. A stand supported by the Kenya Secondary Schools Heads Association chairperson.
Our children are at school and they will remain there, the three groups that are there.
It would not be wise for us to send these children back home, especially those in boarding schools, because they are relatively safer within.
Kahi Indimuli, the chief principal at Machako School and the chairperson, Kenya Secondary Schools Heads Association, says the COVID-19 pandemic is slowly becoming a full-blown education crisis.
We know the effects of prolonged closure to the children. Apart from the known teenage pregnancy and drugs, it's a medical problem, it's a medical challenge, but let's not allow the medical challenge turn into an educational crisis for this country.
Term 2, which began on October 12th, would end on December 23rd, with another 11 weeks for Term 3, set to run from January 4th to March 2021. However, this plan would only work assuming full reopening takes place by latest November 2nd. Critically, the government may want to redesign the curriculum in order to allow for the academic calendar to be normalized and harmonized by 2022.
Should this continue, that the other children cannot be brought in, but we remain with the candidates, Class 8s and the rest until they sit their exams, then it will require that the stakeholders and curriculum designers and developers must sit down and now think of how do we transit the children to the next class. For example, once the Class 8 sit KCPE, they will be expecting to join Form 1. And as things stand, we have a group of Form 1 students who are yet to finish their coursework of Form 1 and then transit to Form 2.
A planned crisis meeting next week will discuss various possibilities, key among them the proposal to alternate classes. This, however, can only work for day secondary schools, but with a lot of challenges. For primary schools, the government might consider learning in shifts.
It would mean you'd need two sets of teachers in order for us to do this kind of tracking system. So that track 1 has a set of teachers who will close and go with their children. Track 2 comes in with another set of teachers who will do their track.
Meanwhile, school heads are now demanding for each school to have a qualified medical staff on standby for quick detection and attention to COVID-19 cases. This even as it is emerging that teachers do not have a medical insurance cover in case they contract COVID-19.
Now we are learning that the medical insurance cannot cover pandemic, but we are in a pandemic situation and people are going to fall sick. Therefore, and teachers now have become frontline workers, given that we have the children in our schools.
Shadrach Miti, KTN News.
So now as Kenya continues to have that conversation, Education PS Bello Kipsan maintains that students are safer in schools. Listen in.
We cannot continue insisting as parents and as adults that we should not open schools because we are exposing our children. Evidence and empirical ones for that say that our children are safer in school because that's a regulated environment. When we leave them at home, when we go out to our offices and our businesses, we don't know whom they're interacting with in that environment around their homes. So, as we work with our colleagues in the Ministry of Health, We work with our colleagues in the Ministry of Interior. We shall monitor the behavior of the virus. When it is optimum that we can return the other children to school, we shall go there. But we shall be very reluctant, extremely reluctant. And it is not in our thoughts that the children who are already in school, we shall tell them to go back home. It is a remote thinking on us as managers of education.
So I want us to talk to Were Onyino, who is the president of the Kenya Medical Association, on the dilemma of opening schools in the middle of rising numbers in a pandemic. So, Daktari, several schools have introduced lockdown. Now, that's England, Belgium, and Germany and France. Now, however, schools remain open in all those countries, and one would ask why. Now, and remember, our own education, CS George Magoha said that schools will remain open.
Thank you, Linda. So I think on the issue of schools, we, as the Kenya Medical Association, we gave guidance on how to approach this, and even WHO through the Ministry and also the Ministry of Health has released guidelines on how schools reopening should be handled. We still insist that we need to have proper sanitation facilities for water. We need to have the social distancing, which I know it's difficult to implement in schools. But as it has been stated, and in other countries, as you have seen, actually the risk, the approach towards schools is a risk-based approach, meaning that we are able to monitor and constantly report and manage the cases as they arise. And if we follow the protocol that has been given by the Ministry of Health, then as we see the pattern all over the world, our children are not at risk compared to the older, let's say the adults or the older children.
Right. In fact, Dr. is about to ask you about that, because there is a debate, you know, that children are way safer, they're better safer in schools than at home, because when they were staying at home, some of them were actually roaming around. Some were not even obeying the COVID-19 measures that have been put in place by the government. Hence, back my question: are children safer in schools or at home?
That's a very difficult question to answer without the necessary scientific research to support it, whether they are safer at home or safer in school. What we know that if children are in schools and we follow the proper guidelines as given by the WHO in terms on how to handle cluster infection, how to manage take risk mitigation measures in our schools, then I think we'll be able to monitor these children. And what I think is more important, especially for the schools, is to ensure that they are linked to health facilities and they follow strictly the guidelines that have been given. In case there's any teacher or any child who turns positive, then that is managed and continue to take the precautions as the children are in school. So I won't agree with the assertion that if children at school are safer, unless we see the scientific evidence supporting that. What we know in school is we can be able to put measures and enforce them, because the children are there with the teachers and the guy most of the time. But at home, when parents are working and children are roaming in the estates, then it's very hard for you to actually enforce that.
All right, Dr. Let me go back to your initial statement and kindly expound this for us, because there is a research that shows, you know, that children can catch the virus and shed viral particles, and older children are more likely than the very younger kids to pass it on to others. How true is this?
Actually, research has shown that children are more of carriers of this particular virus, just like any other respiratory viruses that we see. Most of the time when you see our children, when they go back to school after the holidays, you see they normally come home with common colds and flus, which they transmit to adults, and adults tend to be affected more than the children. So the children can handle it, but we should not also issue a blanket statement about that, because we know in terms of the registry of diseases in this country, it's something that we need to improve, because we have children who are in school who are asthmatics. We have children in school who have sickle cell anemia, leukemias, and these children need to be identified and segregated and because they are more at risk when they contract the virus. So it's a risk-based kind of certification and approach in our schools, but we need to do more and link all these health, link the schools to health institutions, and more so even to a health practitioner who's able to guide the teachers in case of any outbreak.
So, Dr. can we say that schools are not like the hotspots for COVID-19 infections, from your explanation?
For my explanation, they're not hotspots per se, but they can be a breeding ground, because the children, from experience, even managing some of the patients, they tend to come out well with the infection. But when others now, when they go back home, interact with the older children or interact with the parents, there is where the danger is. Because once the guardians catch this infection, then they take it back to their work offices. And this can serve as a place where, like a breeding ground, and make the situation worse if we do not properly take measures in our school and properly screen to ensure that they do not serve as breeding grounds for the infection.
Right. So what can the government do right to ensure that, the spread of COVID-19 in schools, should it be reported, the surge, that it doesn't go higher than that? Because, several schools have remained closed. And sorry for that. And there's some figures that were released by the government saying that at least 35 teachers have been infected. So what can the government do right to ensure that COVID-19 surge is not reported in schools that have been reopened?
Thank you for that. I think the constant surveillance in our schools and the ability to be able to pick the infection early and control it before it blows up in the school and for the schoolers, maybe to the community. So we need to ensure that in our schools, first of all, we have children segregated according to the different age groups. So the younger children and the older children should try as much as possible to ensure that they keep apart. We should ensure, even when they go for their game breaks, we should ensure the teachers are well screened and they're able to wear the protective, personal protective equipment, masks, so that they also protect themselves. And also we ensure that our schools have clean water and sanitizers, which I know is a challenge in most of our schools. And the other thing is we need also to think about employing more teachers, so that like what you have implemented in the health sector, where once a teacher is affected, then you do not disrupt the classes again, where another teacher can come and stand in while the other teacher recovers. So proper surveillance in schools with testing and quickly identifying an outbreak and controlling it is what the government needs to do to avoid having schools being a breeding ground and to avoid the unnecessary deaths we're seeing for some of the teachers who have left.
And it's good you've talked about, that mass testing, because that is the same thing the government was talking about, mass testing. But kindly talk to us about this mass testing, because it means that taking samples from children and teachers in case a COVID-19 case has been reported. But there's also an emotional turmoil that this can have on children who just reported back to school.
Yes, and earlier advice to the government, we actually said that's why we were very keen in terms of insisting linking of these schools with a health facility, and this health facility should have a properly trained healthcare worker to handle the psychosocial aspect and the mental issues that will arise from the trauma that children may undergo in our school. So what we need to do, there are more advanced tests that are child-friendly that can be used, screen and use that. We don't need to test all the children, all the teachers, but can do random testing or use the test definitions that have been provided by the Ministry of Health to be able to identify early and control any suspect cases that will occur in our schools. But I think what is more important, we really need to protect the children who have comorbid conditions. We have issues of asthma in this country that's affecting most of our children. We have children who have diabetes type 1 and others who have leukemia. These children need to be identified and be protected by the government.
All right, and Dr. as we end up this conversation in a minute, since the day schools were reopened until now, can you say that the government has put in place full measures to ensure that, COVID-19 cases don't rise in schools?
We have not seen from our end. We're relying most of the time from the data that you get from the media houses. But just if we postulate from the way we have been carrying ourselves with the mass rallies all over the counties, where our children are going to school, exposing their parents and their guardians to COVID and they take it back home, the teachers take it to school. I don't think the government has done all that it needs to do to actually control these infections. Because if out in the public, out of schools, we are seeing what we are seeing, we're really worried. And what worries us even more is the increased number of healthcare workers who are now getting infected because they still lack proper personal protective equipment. Some of them have not been trained. The public is careless. Our leaders are not leading by example, especially the leaders who are going around this country and encouraging people to come for those rallies. I think the Ministry of Health and the Ministry of Interior needs to take this very seriously and ensure that these rallies at least stop, because if it continues like this, we are going to continue exposing everyone, and it's a very sorry situation in a country like Kenya for us to continue behaving in this manner.
All right, thank you so much, Dr. Were Onyino, the president of the Kenya Medical Association, talking to us about reopening of schools and the surging numbers of COVID-19 in the country. So far, we know several schools have been closed because of reported cases of COVID-19 among the pupils and also teachers. But then the launch of the BBI report has led to increased political activity as leaders drum up support for their stand on the review of the law. Now, as leaders hold political gatherings, a worrying trend is emerging: the breach of COVID-19 containment measures. Now, thousands of people are at risk of contracting COVID-19 at the crowded rallies where a majority do not wear masks and social distancing is not maintained. So our politicians actually fueling the virus. As senior reporter Rita Tinina captures